Hi, welcome to Fertile Mind. My name is Dr Violet Kieu and I'm a fertility specialist with Melbourne IVF. Today I want to talk about the top 10 things that a fertility specialist might do in their day. Number one, the first thing that I do is scan in the morning, and we do follicle scanning. So that's counting the number of follicles and the size of the follicles, so we know when to trigger and to collect your egg as part of your IVF cycle. The second thing that we'll do in a morning would also be radiology, and that would be pregnancy scans. That is, of course, the culmination of the IVF cycle. So after 2 weeks after the transfer, you'd have a positive blood test, and around the 7-week mark, we'll do an ultrasound to see the pregnancy. After scanning, the third thing I'll do in a day is go to theatre, and that's when we'll do the procedures such as the egg collections or oocyte pickups, the OPUs. Once you're asleep, the pickup, about 15 minutes, will gently guide a needle and collect the eggs through your pelvis. Number 4, embryo transfers. So also in the morning, I'd walk across to day procedures, and for a different patient, on day 5 usually of their embryo, transfer the embryo into their uterus. It's a team effort. We have our dedicated embryologists and our lovely nurses who are also doing the ultrasound scanning on the abdomen so that you can see us put the embryo back in. All eyes on board. Number 5, I think it's time for lunch. At lunchtime, we can also have an education meeting, and this is when we can talk about scientific breakthroughs, clinical matters, or even meta matters, so things such as leadership, teamwork. And this encompasses our multidisciplinary team of embryologists, nurses, as well as other specialists or registrars, fellows, or medical students. Number 6, so after lunch, time for consulting. That's when we'll see all sorts of patients, individuals, couples, those who are looking to, say, freeze their eggs or to attempt a pregnancy, or even those who are interested in donor services such as donor eggs, sperm, embryo, or surrogacy. Number 7, also more consulting, but these are review consults, and these are for people who may have had IVF treatments before, but we're looking again, maybe a second opinion or other ways to optimize their chances for the future. Number 8, research. We have research meetings, and this is so important to hear everyone's ideas about what we can do to improve the quality and the flow of our IVF services. It's really important that we do ethical research, so we do put our projects through a Human Research Ethics Committee for scientific, clinical data collection or surveys. Number 9, on a different afternoon, instead of consulting, we might go to theatre. Theatre is so important for some conditions such as endometriosis, which may affect your fertility. We can do keyhole surgery called laparoscopy, as well as do tubal flushing to look at the movement and the flow through the tubes as they pick up the egg, as well as hysteroscopy, where we put a camera into the uterus to make sure everything's all right. Number 10, collaboration with the laboratory. If there's time or it's a different afternoon, I might pop by to lab just to learn and see what they're doing. So to when they do the embryo check to see fertilization, when they thaw an embryo before I transfer it, or even to watch them freeze, it's really vital that as clinicians we understand the science, have a first-hand view of it, so we can tell our patients what happens in their very important lab. So, thanks so much for your time to listen to the top 10 things the fertility specialists might do in their day. If you'd like to hear more Fertile Minds, please like and subscribe. Appreciate it.